Hi, everybody. This is Dr. Lauren Allison with masterthebody.com. And today I wanted to talk through basically a recent post of mine about is serotonin the answer to everyone who is depressed? And really what this is about how to feel better and get rid of depression using neurotransmitters and a simple way to evaluate your needs. Now, knowing a lot about neurotransmitters is very cool, although it doesn't do much good to know that the majority of serotonin is made in your gut, or that the dopamine deficiency is basically the cause of Parkinson's. And obviously there is a lot more to these two examples than that. But there is tons of excellent information out there on the web, which is very scientific and detailed. And for those of us who are clinicians, this is kind of the golden age of access to information. That being said, it is still not very practical in terms of helping people feel better. Much of the information is heavy on details, but extremely light on applicable use for the average person. So I would like to say that if you are unable to find a way to get these answers for yourself, or from a clinician who is knowledgeable enough, for which there are still far too few of them capable of doing it well, then you are still going to be feeling messed up, ineffective at your life, and searching for answers. So hopefully in this podcast, I can give you a little bit of practical and actionable advice. So I will try to give you some now. There are many good written evaluation forms that you can fill out, which are extremely accurate at identifying dominant neurotransmitter profiles. For example, in the Master of the Body Clinic, we use numerous forms to identify neurotransmitter deficiencies so that we can better assess changes needed to lifestyle, diet, and supplements, which helps us balance those neurotransmitters not only with supplements, but with diet and foods. Now, aside from the extensive eval forms we use in my clinic, I would suggest to you a great form that is available to the general public, and I really love this form. It's at www.bravermantest.com, no spaces or dashes or anything, bravermantest.com. Now, this is an excellent form for identifying dominance and potential deficiencies of neurotransmitters in order of importance. And I sometimes use this in addition to the evaluation forms we use in the Master of the Body Clinic. Now, it is a great way to get solid information about how someone's dominant neurotransmitter profile helps identify character traits and behavior. So it is very easily accessible, obviously, which makes it a great resource. But in addition to that, it is fantastically accurate, that I have found. So this can be something that you can use to figure out what is a dominant neurotransmitter that you function off of, and potentially any deficiencies in that neurotransmitter or others. And the most important thing about this is that if you can get that straight, it will give you an overall sense of well-being that can be very, very difficult or hard to come by, even using a lot of other approaches. And functional medicine is getting much better at cozying up to the neurotransmitter issue because, it's a work in progress. But this, I have found, can be above other issues, such as thyroid and adrenal. So here I'd go over a brief case study that I can recount that gives some indication of this and how going up higher in the cascade of hormones and hormonal function, neurotransmitter function and brain function can actually help with thyroid and adrenal issues. So we had a mid-40s male, call him John, that came into the clinic who had been suffering from depression, low mood, abdominal discomfort, digestive problems, underactive vagus nerve tone, complete lack of desire or libido, great difficulty concentrating or focusing and exerting physical effort or mental effort in any form, essentially. And in addition to this, he would get excessively angry very quickly over seemingly innocuous comments by certain people. This person had been given multiple antidepressants over the years with less than moderate improvement. When improvements were made, he became very physically tired, even more than previously. Although his depression was improved, he was virtually ineffective at being productive by any measure. Now, he had also seen several holistic doctors and was diagnosed with adrenal fatigue and given protocols for improving energy levels. Again, at times he made slight improvement, but mostly not much improvement. So after he came in, I evaluated his previous tests, which included blood labs and some functional medicine tests. And next, I had him fill out several evaluation forms for neurotransmitter dominance and neurotransmitter deficiency. And what I found was that his neurotransmitter profile in order of dominance was number 1, dopamine. He was dopamine dominant. GABA was number 2. Acetylcholine was number 3. And serotonin was number 4. So in this order, that was the order of importance. Those neurotransmitters had to be addressed for him to feel normal. At least that's the way it appeared. So after identifying that, we went into the deficiencies, which just happened to scale exactly the way that the previous list was: dopamine, number 1, number 2, GABA, number 3, acetylcholine, number 4, serotonin. So as we provided the precursors for those neurotransmitters to be brought back into a better balance, John did exceedingly well. And he seemed to change completely by personality, was highly motivated, very active, and much, much, much happier and more balanced emotionally. Now, this was within, well, it actually happened much faster. It was within a few months, but it was clear within a couple of weeks that the path was correct. Now, within a year, he had made massive strides, not only with his work, but what he was attempting to do. His emotionality was almost entirely controlled. He was a much happier person. His wife was much happier because he was much happier. And they were doing very, very well. And for all objective opinions around him, he was himself. Now, the amazing thing about this case study was that not only does it fly against the current model of symptoms lining up with serotonin, but we have to ask the question, could it be, and in my mind I think it is, that we are missing the boat here, that many people diagnosed with depression may be depressed because they are actually dopamine dominant and deficient simultaneously. So they need that dopamine. Their character, personality, physiology runs on it, but they don't have enough. They're not producing enough, whatever the factor is, high stress level and so forth. So many depressed people haven't been able to focus or work on the things that they desire, and they have no drive to make them happen. And could it be, in these scenarios, that many diagnosed depression cases are actually super motivated people by nature, but unable to act due to dopamine insufficiency? If so, then in these cases, they would primarily need dopamine, not serotonin. And of course, the caveat to that is, and I can tell you, from 18 years of clinical practice, every case is different, but it helps for us to be able to put them into categories so that we can then tweak and find out the nuances for the individual. Now, moving into acetylcholine. So a lack of clear thinking can clearly come from acetylcholine or deficiency in acetylcholine. And I have seen cases where a person is acetylcholine dominant and they are absolutely having a problem with acetylcholine, but they've been giving something like precursors for GABA, and it actually can twist them around, make them more anxious and so forth. Now, that is a discussion for a different podcast. But in John's case, filling in that acetylcholine deficiency made him remarkably and almost scarily effective. I mean, this person was not necessarily hyper-driven, but the person I saw after working on straightening these neurotransmitters out was a completely different person, super productive, but also very relaxed and not overly wired or super tensed out about what project needed to be done and when it needed to be done by. It was remarkable. He's one of my favorite case studies to look at, to see that when you get these neurotransmitters right, you really bring out the best of the person and what that person was meant to be. So precursor in the form of supplements is the fastest way I've seen to straighten these issues out. Now, people who know me and the patients who know me know that I am absolutely all about food choices and getting nutrients from food. But they also know that my experience dictates that in many cases, whether it's because of our food quality and so forth, this is almost impossible to accomplish. So using precursor supplementation is, I think, at least the faster way to get the person so that they can stop the supplementation after a point and they're good to go without additional supplementation. Now, if you are concerned about your balance of neurotransmitter dominance, I do highly recommend the Braverman test, bravermantest.com, that I mentioned earlier, because of its simplicity, accuracy, and extreme helpfulness in determining supplementation, diet, and lifestyle future forward to keep those neurotransmitters in line. And once you know your nature better, that you can have a toolbox or a toolkit that you go to when you know, I'm kind of slipping, my stress level's been a little higher. I think I need to put in a little extra to support my dopamine dominance or my acetylcholine in terms of dietary factors and supplements. And then you know yourself. You almost become a better doctor for yourself, someone who knows their body. And to me personally, I think that is one of the things that the culture, not only the culture, but the global community is missing, is this dissemination of basic information. It's hard to even get it right in the medical field, but if it can be disseminated out through functional medicine so that people become aware of how their body works, basics for them to be efficient and effective at their lives, because that's really what people want, at least from what I've seen, is you want to be a viable contributor to the world. And it's very frustrating for people because they know that they have gifts and they know on some levels they want to give those gifts, but they become crippled either by whether it's neurotransmitters or other nutrient issues, glandular function, just health or feeling not the best in general. So this is one component of that. I have found that balancing neurotransmitters can have a huge impact on other conditions, such as I mentioned before, thyroid or adrenal imbalances, or what are still being called adrenal imbalances, even though that the adrenals themselves rarely have physical problems. It's really more of balance issues with their output and the rest of the system, either parasympathetic or sympathetic, fight or flight imbalance. Again, podcast for another day. So I hope that this is helpful. As usual, let us know if there's anything that you feel that could be better addressed to help you understand some of this content a little better. And we will be more than happy to give you that information so that you feel as informed as you possibly can about any topic that we talk about on the podcast. So again, this is Dr. Lauren Allison with masterthebody.com. Visit us over there, and hopefully you'll get some more useful information, and send us suggestions. We're always open to those. We want to be as much help to as many people as possible with the information we provide. Thanks for listening. Have an awesome day.